I'm Dr. Jeff Donatello. I'm the CEO and co-founder at the Center for Wellbeing here in Portsmouth, New Hampshire. And this is a Q&A on stem cell therapy. And I have a bunch of questions here. I'm not sure what these questions are until I look at them. So let's see how we can help you, because I've been told these are the most commonly asked questions. Okay, so the first question is, where do these stem cells come from? Let's back up the truck a little bit. All from the United States of America, cord banks. A cord bank is a company that goes around and they find out with certain hospitals when women raise their hands and they say, you know what, I'm having a C-section birth and I'm going to donate this tissue. The woman has to be healthy, baby's healthy, nobody's harmed, and it's donated at the time of birth, and it's third-party tested under FDA guidelines for disease and any issues. So we make sure that it's very safe, and then the product is sent to a manufacturer and it's cryogenically frozen and shipped to the actual practitioner, who will then thaw it out and put it in you. Next question, here we go. All right, let's see. What can stem cell therapy help with? Well, pretty much anything for the most part. It's the building blocks in your body of how you heal. But in the United States, really, having had 3,000 to 4,000 patients, we've lost track, somewhere in there, and we brought it to New England 10 years ago. We found that there's certain things that can work much better than others. If you have arthritis, a degenerative joint, knee, hip, neck, back, wrist, hands, even a disc lesion, a low back slip disc, that's where we get the best results. So really, most of our patients are people with knee issues, for the most part, or shoulders, that are active people getting maybe into their 50s, 60s, 70s, and they can't be independent or do what they used to do because of an injury that happened from in their 20s, 30s, and 40s. So that's really the biggest thing we help are injuries that are chronic or arthritic-based inflammation type injuries. Okay, here we go. What's the next one? We have, is stem cell therapy FDA approved, right? The FDA was set up to make sure drugs and food don't cause damage to the general population in the US, but this is a biologic. It sits outside of the guidelines, so it's never going to be approved. It falls under what's called 361 guidelines. So these products have to be under homologous use, meaning the donor that we get it from, which is from the umbilical cord, is type 1 and 3 cartilage. The place we put it, like in the knee, we put it into type 1 and 3 cartilage, homologous use. We can't say we treat anything, and the product can't be grown or manipulated or have anything done to it, chemically altered. If you follow those 3 things, it's totally legal here in the US, and that's how that works. So we're excited. This isn't new, it's been around for about 10 years. But we hear that question a lot. How long does it take to see results? This is different for everybody. I always talk about my father-in-law. He had a knee replacement. He wouldn't do this for some reason. Jim, if you're watching, you know this is you. And he finally said, you know what? I'm gonna work on the next knee because that's just as bad with you guys. And Jim swears up and down that as soon as he had that joint injected, he had no pain. That happens to about 10 to 15% of the people. Pain goes away and they don't get it back and it's gone. The majority of people will notice pressure at the time of the injection, and then over the next week or two, they'll usually notice 10 to 30% improvement, but healing can occur all the way up to 6, sometimes 9 months. It really depends on how you take care of your body. The healthier you are, the better you eat, the more you don't beat it up with the wrong exercise. Afterwards, that's how you heal quickly. And then the same note, people say, how long does it last? Well, that is determined by how you take care of your body, once again, right? If you damage the joint, of course, it's not gonna last as long. But most people, if you had to hold me to that, how long does it last? I would say 2 to 5 years. Most people get results, especially for arthritic conditions. Next question, I grabbed 2 of them. What have you seen for side effects? We get that all the time because people are used to it. In the United States, work with drugs, and drugs all have side effects because it's not a natural product or a natural way of doing things. Now, can you have side effects? It's usually user error or something to do with the lab itself. We use a really great lab, and we use a product from Platinum Biologics, which is the #1 selling product manufacturer in the country. We've never had any issues, never. To have side effects, you'd have to maybe use a dirty needle or something like that. I mean, having had all these patients, everything's done in a very clean way. So that's the great thing about this. The side effects are nil, unless the injector does something wrong, which we've never had that happen. The product's not going to give you side effects because basically it's exactly what you have in you, just way more of it to make things work better so that you can heal. How much does it cost? Everybody still 10 years later says, well, it's not covered by insurance, right? If it was covered by insurance, just to let you know, a little side thing here, cortisone probably wouldn't exist anymore because this is the most anti-inflammatory substance known to mankind. It's what the body uses to decrease inflammation and heal tissue. To answer your question, we're $5,600 for 1 cc or 1 joint. And for the second joint, it goes up to $8,600 total. I tell everybody this, if you look around New England nowadays, we have competitors, it's probably gonna be cheaper. Now, why do I say that? I think that the reason we're more is because we have a medical doctor, which I'll talk more about, that uses video fluoroscopy. He has a surgical suite, he uses ultrasound, he has 35 years of experience. And if you're looking for a deal, call me because I know people that I can refer you to that will be less cost-wise to you. But most of the time people come to us because we're the experts, we have the most experience, and our doctors have seen 10 times the amount of patients the average nurse practitioner in the state of New Hampshire at least has seen in the last 10 years. What does the procedure look like? Well, 90% of our patients are either referred, they find us on the internet and they feel comfortable with what we want to do, they talk to me, that's the first step. Actually, that's the second step. We'll talk about the first step in a second. But if you do get to me on the phone, I'm going to pretty much talk to you and find out, do you fall into that category of somebody we could help? If you do want to go through with the procedure, after we schedule it, our medical doctor will examine you, and he actually does the procedure same day. And it's very simple. You go into his surgical suite. It's almost like people want to make it more than it is. It's a relatively painless shot under guidance. What he does is this. You can do all the exams you want in the world, but until you use fluoroscopy and ultrasound to look and see what's going on in that tissue, you really don't know. So he's going to look at the tissue, determine where the damage is, and inject it right then and there. And then you put some Band-Aid on it, you get up and you go home. We don't want you beating yourself up for a couple weeks after. What does that mean? That means if you overdo it and you feel pain the next day, don't do that again. Okay, if you're a runner, back down, walk, swim. If you're a lifter in the gym, do other body parts just for a couple weeks and then monitor your situation. But it's a very simple procedure. How do I schedule an appointment? Well, it's easy. There's going to be a link in the description below, and we have a very fine young man named Colin Garneau that will call you up on the phone and see if this is the right procedure to you. You'll talk and he'll walk you through the process of what would happen and try to screen you to see if it is something we want to take to the next level to get you back into better health. I'm Dr. Jeff Donatello. Once again, thank you for watching.